Hello there and welcome to Perspectiva. My name is Tom Philpot. Now, for millions of people living in rural Zimbabwe, reaching a doctor can mean travelling long distances, spending money they cannot afford and waiting for hours before receiving medical attention. But a new approach is bringing healthcare closer to remote communities, using technology to connect patients with doctors through telehealth services. But in villages where medical workers are limited and transport remains a major challenge, digital consultations are helping patients receive diagnoses, treatment and follow-up care without travelling to distant towns. One of those patients is Enimore Kadzungi, a 38-year-old farmer who spent months struggling with chest pains and dizziness. After walking nearly 14 kilometres from her home to a telehealth centre, she was diagnosed with high blood pressure for a video consultation with a doctor. Today, she is back working on her farm and managing her conditions with daily medication. But the programme is part of a wider effort to reduce healthcare inequalities in Zimbabwe, where rural communities have long faced shortages of doctors, medicines and medical facilities. The country's telehealth centres are using technology, including satellite internet, to connect patients in remote areas with medical professionals. How this digital healthcare revolution is changing lives in Zimbabwe? Well, here is our special report.
For years, distance has been one of the biggest barriers between rural Zimbabweans and healthcare. For many villagers, visiting a doctor requires traveling tens of kilometers to urban hospitals or clinics. Limited transport options and high costs often mean people delay seeking treatment until their conditions become serious. TeleHealth is now offering a different solution. At centers such as the one in Nyazura, patients first meet trained nurses who check vital signs including blood pressure, blood sugar levels, and temperature. The information is then shared with doctors through video consultations, allowing patients to receive medical advice, prescriptions, and referrals when needed. For Enimore Kadzunge, the service became a turning point. After months of illness affected her ability to work and care for her family, she arrived at the center and discovered she had hypertension. A doctor diagnosed her during a video call and prescribed medication. Within days, she began feeling better. Kadzunge says the nearby facility gave her access to care that would otherwise have been difficult to reach. The telehealth program was launched in 2024 by Zim Smart Villages, working with Zimbabwe's telecommunications and postal services to create digital healthcare access points in rural areas. The centers are placed within existing community facilities, helping reduce the need for long journeys to hospitals. According to the organization, dozens of centers have now been established across Zimbabwe, providing thousands of virtual consultations and diagnostic services. The service has also helped patients like Proud Shamin, who visited a telehealth center after experiencing weight loss, extreme thirst and fatigue. Tests showed she had high blood sugar, and after speaking with a doctor remotely, she received treatment for diabetes. For patients in rural areas, affordable healthcare can determine whether they seek help or continue living with untreated illness. The telehealth centers charge lower consultation fees than many private clinics, making medical advice more accessible for families with limited incomes. But challenges remain. Telehealth cannot replace all medical services. Patients needing specialist treatment, surgery, or complex care still require access to hospitals and specialist facilities. There are also challenges in convincing some communities to trust virtual consultations, especially in places where people are used to face-to-face visits with doctors. Healthcare workers say building confidence has required community outreach and education. Nurses have traveled to villages explaining how the technology works and reassuring residents that they can still receive quality medical advice through digital platforms. The centers rely on technology such as satellite internet and backup power systems to continue operating during electricity disruptions. For many patients, the impact is measured not only in medical results, but in restored independence. People who once struggled to travel long distances for basic healthcare can now receive support closer to home. In rural Zimbabwe, telehealth is not replacing traditional healthcare, but it is helping bridge the gap between communities and the doctors they need.
Well, the expansion of telehealth in Zimbabwe highlights how technology can help address healthcare challenges in some of the world's most unserved communities. While digital consultations cannot solve every problem facing rural healthcare systems, they are providing faster access to diagnosis, treatment and medical advice for thousands of people who previously faced major barriers. For patients managing chronic illnesses like hypertension and diabetes, regular checkups and early detection can make a life-changing difference. Now, health experts say the future success of such programs will depend on continued investment in technology, medical workers, specialist networks and reliable infrastructure. For people like Enimore Kadzunge, however, the benefit is already clear. A journey that once required long travel and uncertainty has been replaced by a local healthcare service that connects her directly with a doctor. In rural Zimbabwe, a screen and an internet connection are helping bring healthcare workers closer to those who need it most. Well, to discuss how the TeleHealth is helping bridge the healthcare gap in rural Zimbabwe, we were joined by Mr. Ritimi Olawale, a healthcare and digital health expert. Hello there and welcome to Perspectiva. Zimbabwe's rural communities have long struggled with limited access to doctors and healthcare facilities. Just how significant is the healthcare gap between the urban and rural areas today?
I mean, in Zimbabwe, like the rest of the African continent, has a deep urban and rural divide in many things, including within the healthcare sector. But generally, even Zimbabwe has dire stats. The African average for doctor penetration in Africa is 2.6 doctors per 10,000 people. For Zimbabwe, this is much lower than the average. You have 1.76 doctors per 10,000 people. But when you then deep dive within Zimbabwe itself, majority of the doctors present in Zimbabwe are concentrated in the urban cities. Unfortunately, as well, they lose many more doctors to the diaspora, to the wider Southern African community, but also to the global community. A lot more health professionals in Zimbabwe seek greener pastures outside of the country. And so this paints a dire picture in where in some big urban cities like Harare, in Zimbabwe, you have a huge concentration of doctors. And then when you go into the deeper rural communities, in many communities, you have zero. Especially when you're then seeking specific specializations, these then become extremely very difficult to find in some of the rural communities in Zimbabwe. So the urban-rural divide is very challenging, and government is trying its best to find alternative means to curb these kinds of divides as they continue to build to strengthen the healthcare infrastructure in the country.
So how is TeleHealth challenging the way that patients in remote villages access the medical advice for diagnosis and the treatment?
I think that telehealth is playing a major role in healthcare access in Zimbabwe, and this is on the back of increase in digital internet penetration in the country. Access to mobile phones has grown, almost 100% coverage of mobile access in Zimbabwe. Many more people now have access to mobile phones. They use tools like WhatsApp to communicate, and they have access to the internet. Many young people in Zimbabwe are connected on social media and are very active. On top of this, government is now building a telehealth and deploying telehealth systems to reach more people, especially in rural areas where access to healthcare is very difficult. It's not unusual in Zimbabwe that people sometimes have to go 25 to 50 kilometers in search of the nearest hospitals. And so the telehealth strategy in Zimbabwe is such that government is building telehealth infrastructures and embedding it into postal infrastructures that currently exist in more rural communities than healthcare centers. As a result, patients can access diagnosis. They can access diagnosis. They can do virtual consultations, and this enables that they have more access to healthcare services than they have before. Telehealth care centers, although it's very innovative, does not solve all of the problems. As you know, there's still opportunity to continue to invest in Zimbabwe's healthcare infrastructure. It does not replace opportunities to build modern equipment, to have a more modern workforce, and to continue to build on the health surveillance systems for the country.
Where many patients previously had to travel long distances to reach healthcare in hospitals, how much of a difference can local telehealth centres actually make in reducing these barriers?
I think the local telehealth centers are already playing a huge role in reducing these barriers, and it can play a bigger role as we see a more broader adoption across the length and breadth of Zimbabwe. Take, for instance, you have in some communities, people have to travel 40, 50 kilometers to reach the nearest health centers. And when they then go, they do diagnosis and they also have to return, to then get specialized care. This sometimes becomes difficult. The cost of travel is something that they have to consider. And so many people apparently just abandon access to health because they can fund the cost of travel. Traveling to the communities is very difficult, and people who have chronic diseases do not reach hospitals on time. And as a result of the time sensitiveness of some of these diseases, it can lead to higher morbidity rates in the country. Therefore, telehealth provides some solutions. It gives access to opportunity for consultations. You have opportunities to do virtual consultations with doctors, but also importantly, in some ways, we're beginning to see healthcare professionals in the diaspora, in Zimbabwe and elsewhere in Africa, using these tools to support the strengthening the healthcare infrastructure systems in country.
Well, what role do nurses play in making telehealth services successful, especially in communities where doctors are not physically available?
I think that the nursing role is very central to delivering healthcare anywhere in the world, including in Zimbabwe. Nurses are central to ensuring that they take vital signs of patients, they collect and take samples, they provide immediate and palliative care to patients. And so the availability of nurses is central. Having nurses that are well trained and are embedded in the communities and can provide immediate and remedial support is very central to delivering a successful healthcare systems. Nurses manage patients in hospitals while doctors provide care. Nurses are the ones that continue to manage the vital signs and symptoms of patients, and this is very central to this as a whole. In the system that is emerging in Zimbabwe, we have hospitals that exist in many cities, especially with a concentration in urban centers. Nurses will then help to ensure that access, especially connecting this to the telehealth centers being built, will ensure that this access continue to improve across board, especially for those in rural communities.
How does a virtual consultation compare with a traditional face-to-face medical appointment, and what are the limitations of this remote healthcare?
I think that remote healthcare cannot solve all the problems, and we must be frank with that. It does not replace access to modern equipment where you want to do diagnosis, but in terms of helping to provide a first layer of care and a first layer of consultation, I think it's very important. And so when you do virtual consultations, it helps doctors to and healthcare professionals to understand the diagnosis, to provide immediate support, sometimes to also see trends that is happening, especially for public health concerns. So if in a specific community, during consultations, doctors are beginning to see emerging trends around, for instance, emerging healthcare diseases. For instance, in some parts of Africa at the moment, we have emerging Ebola crisis, especially in DRC and Uganda. With the advancement of virtual consultation, doctors can begin to see such emergence and deal with it before it becomes a national crisis. But there are limitations as a result of this. There are certain things that can be discussed virtually, and there are certain things that a patient needs to go into a physical healthcare system to have access in order for the doctors to be able to conduct a more physical examination. And so these are the challenges that you have, but you also have the challenge of broadband internet access that can be spotty in some parts of Zimbabwe. And so connections can be very difficult and challenging. And as more people get used to the system and you have broader access, I think that the access to virtual consultation becomes very essential, being embedded into the healthcare system in the country.
Zimbabwe faces shortages of doctors, medicines and medical equipment. Can telehealth help overcome these deeper challenges to this healthcare system?
Telecare has its own limitations, and we must be very frank to what telecare can do and cannot do. Telecare cannot replace medical consumables, cannot replace medical equipment in an hospital, cannot do laboratory assessment and diagnosis. What telehealth can do is to ensure that patients have a first line of care, can do diagnosis, can ensure that patients have access to sit in front of a doctor, can ensure virtual consultations, can help to recognize when an issue is emerging and needs hospital care, and so fast track access to a hospital. These are the things telehealth care can do. But in terms of access to medications and medicines, government needs to continue to budget and to improve its logistics distribution to ensure that vital medical drugs and equipment are available at healthcare centers across the country. But what we begin to encourage, especially not only in Zimbabwe, but across the continent, is a way where you have an integrated strategy where telehealthcare plays a vital role in ensuring that people in rural and remote and hard to reach communities have access to immediate care, but also you have an embedded structure where when this becomes advanced, you can move them into hospital care where they have access to modern equipment and medication.
So how important is technology infrastructure like reliable internet access and electricity in ensuring that these digital healthcare programs succeed?
And that's one of the things that we have to consider. Without internet penetration, without access to the technology itself, telehealth would not work. And so the opportunity that telehealth gives today is because of the widespread adoption of the internet, but also the penetration in rural communities. Like I said to you, Zimbabwe has almost reached 100% digital penetration for mobile phones. And so in every nook and cranny of the country that you go to, people have mobile phones. Young people in the country are on social media. They use WhatsApp to communicate. They are on TikTok, and so this gives a broader access. But also on top of that technology is for you to also recognize that a significant chunk of Zimbabwe's trained healthcare professionals are now in the diaspora. Many of them in the broader South African country cluster, but many of them also have immigrated to Europe and to the global north. And so on top of this, these professionals who are in the diaspora can use the technology to also support Zimbabwe's healthcare infrastructure by helping to provide knowledge and also transfer of knowledge and skills through telehealth. One, to train healthcare professionals on the ground in Zimbabwe and to strengthen this kind of collaboration with global institutions, but also to provide consultations to people in rural communities across the length and breadth of the country.
Well, some rural communities may be unfamiliar or uncomfortable with speaking to doctors through a screen. How are healthcare providers building trust amongst the patients?
I think that is a two-way thing. Perhaps 5 years ago, this would have been a challenge. But as we continue to see global adoption of technology, I live in Nigeria, for instance, and I remember many years ago, it's an unfamiliar sight for us to have video calls. But if you see today, even grandmas in the villages speak to their grandchildren because they have a mobile phone, they're on WhatsApp, they can do video calls. And so this opportunity to speak to people on the screen is no longer very, very strange as it used to be. As we see wider adoption of technology all over the world, and you have a greater percentage of Zimbabweans in the diaspora. You have many Zimbabweans in the diaspora in South Africa, all over the global north. They constantly speak to their friends and relatives. They send a huge remittance back home. They provide funding, finance. They speak to their friends and family back home. And because these interactions, social interactions happen, it is not difficult to translate this into the healthcare system. There might be some barrier because of trust. Of course, many people would prefer to sit in front of an healthcare professional as against speaking over the phone or virtually. But these barriers are lowering on a regular basis. And as we see greater adoption of technology, I imagine that these barriers will disappear over time.
So chronic illnesses like hypertension and diabetes require regular monitoring. How is telehealth helping patients manage long-term health conditions?
I think that managing long-term health conditions rely on accurate diagnosis, monitoring the trends, but also having access to prescribed medication on a timely basis. Telehealth can solve some of this problem, but cannot deliver the goods as a whole. And so, if patients have opportunities to take some diagnosis remote outside of hospitals, they can push this data uh, via telehealth to healthcare centers, and then this can ensure constant monitoring. For some chronic diseases, they require monthly visits to the hospital for consultations and monitoring. These can be done remotely, but in terms of access to medication, having access to their medication also can actually be delivered without them visiting a healthcare center. And so you can eliminate the back and forth that patients have to do on a monthly basis, which, if it's routine visit, can be eliminated with telehealth care centers. But if they need access to advanced diagnosis and they have to sit in front of a doctor or go to a laboratory, then they have to visit a hospital. But in terms of eliminating the regular monthly routine visits, these can be done remotely. We're also seeing emergence of in many countries, including in Nigeria, in Ghana, in Rwanda, where this was pioneered, where we're seeing people using drones to deliver vital resources to hospital. We're using drones to deliver blood samples and supplies to hospitals in remote villages, where the concentration is in urban cities, and technology startups are using these infrastructures to deliver across board. What we're also seeing is people helping to support. We're also seeing startups emerge where they help to deliver medications to people across the length and breadth of the country. And so, as telehealth systems continue to build in Zimbabwe, you would see the layering and the different offerings that will support the entire ecosystem to ensure that telehealth becomes part of the resilient systems that Zimbabwe is building to support healthcare for its citizens.
The programme has expanded to multiple regions of Zimbabwe. What challenges remain in scaling these services nationwide?
I think that the challenge to scaling requires adequate funding, but also triangulating the service in such a way that access to medical records becomes digitized. Because as people continue to adopt and use telehealth, you must digitize access to medical records. So, if, for instance, someone wants to offer a service or currently have their records within an hospital healthcare system in a specific region or zone, if they access telehealth, how do you have access to that record in a way that that access to care is continuous and it's not broken? That's one of the things that Zimbabwe has to figure out to fix as they continue to expand. And the other thing is also access to funding. Zimbabwe is a country that is struggling economically and continues to mobilize, generate internal resources, but also seek the support of the global north to support its delivery of social goods, including education and health. And so, as more funding becomes available, Zimbabwe will continue to expand and build on strengthening and scaling the telehealth to national adoption. What I can easily say is that telehealth systems have come to stay, not only in Zimbabwe, but across the world. During COVID, when we witnessed COVID several years ago and people could not move from one point to the other, I think COVID helped to fast track the adoption of virtual consultations globally, not only in the healthcare sector, also in education, also for business, B2B meetings and business meetings. We've seen a bigger and a greater adoption of virtual consultations. And so, with this in mind, I potentially foresee greater adoption of telehealth systems in Zimbabwe, and I hope that within the coming years we would see national scale and national adoption and global coverage for healthcare systems in the country.
Can telehealth become a model for other African countries facing similar shortages of healthcare workers and limited rural access?
I think that as we begin to do this, we need to pay attention to several things. We're seeing the emergence of artificial intelligence. Some countries are pioneering AI-driven telehealth systems. We have to have caution in the way this is used, because when it comes to healthcare, you don't want artificial intelligence to provide false diagnoses and responses to patients. That's one bucket. So as we begin to see expansion, countries, especially Zimbabwe and many countries on the continent, and I think this is a global challenge, has to figure out what role can AI play within these entire ecosystems of providing telehealth care systems on one bit. The second part is also around data privacy. As you begin to use more telehealth solutions, you have the data and records of private citizens digitized and transmitted between one point to the other. Countries need to figure out where are the servers located, who owns this data, how do we protect that data, and how do we ensure that we have a backup of that data in terms of protecting it against threats or being stolen by people who want to use it for nefarious activities. And so we would see the emergence of policy around data privacy, protecting the records and the sanctity of records in the country as healthcare professionals continue also to partner with IT professionals to see how we can build a more robust systems in country globally. Finally, also is to look at the technology infrastructure in itself. How does the technology infrastructure emerges in the country? It becomes also more vital that this technology infrastructure remains optimum and they do not go down, because if they do, then the access that they provide not only to communication but also to healthcare and education will be significant for a country like Zimbabwe. And so we would see more policies also around this as we continue to go.
And looking ahead, what investments and policy changes are needed to ensure digital healthcare becomes a permanent solution rather than a temporary response?
I think that the future of telehealth in Zimbabwe is very bright. We would continue to see greater adoption. I foresee a future where telehealth in Zimbabwe has national coverage, that rural women who want to manage pregnancy and delivery of babies can have routine consultations with doctors from their mobile phones while they sit in their farms and while they sit in their rural communities, can benefit from access to the best doctors, Zimbabweans in diaspora, from the comfort of their villages. I foresee a future where government officials and public health officials and health policy workers can connect the dots of trends that they see emerging and can deal with public health issues before they become crises in country. I foresee a future where telehealth care centers, government continue to invest and dedicate a significant portion of its budget to ensuring that they provide care and faster adoption nationwide for these tools, but more importantly, to embed it with existing healthcare infrastructure and systems in country such that records become digitized and available at the click of a button, and a patient can have and benefit from more robust care from government. And for me, from my final point of view, and I think this is also where international partners can support the country in bringing telehealth to scale. We can see Zimbabwe can benefit more from international partners, can benefit more from philanthropic institutions, and can benefit more from global collaboration, especially in terms of bringing technology transfer and technology know-how to help Zimbabwe to strengthen its push to have national coverage of telehealth centers within its country, but also to develop homegrown, robust solutions that benefits the people of Zimbabwe. And I hope that in future, Zimbabwe would have a more robust healthcare for itself and for its citizens.
Perfect. Thank you so much for your time. I appreciate it. Well, that is all for today's edition of Perspectiva. Our thanks go to our guests for sharing their view on the role of the telehealth and providing timely medical assistance to the rural areas of Zimbabwe. Please, for more stories and updates, follow us on social media or visit Asia One News TV. I'm Tom Philpot. Thanks for watching, and we'll see you next time.